Officials with the CDC say the spread of the flu virus in Tennessee is very high. However, doctors say they're starting to see the number of new cases stabilize. That's a sign we are at or nearing peak season. Reporter Mandy Gaither talks to a pediatrician about why children are one of the groups at highest risk and also how to protect them.
In the U.S., hospitalizations for flu in children younger than age 18 have the highest peak weekly rate in more than 15 years. And in the latest week of data, there were 15 flu-related pediatric deaths for a total of 32 reported child deaths associated with flu this season. The CDC says 90% of those who died were not fully vaccinated against flu.
Children, especially under the age of 2, they're pretty small. And when they're still small, you get something that's just so inflammatory, like influenza. When it gets into your lungs, it causes a lot of inflammation.
Dr. Frank Esper with Cleveland Clinic Children says the best protection against severe disease is for adults and children 6 months and older to get a flu shot.
By protecting yourself against influenza, you're also protecting everybody in your family.
Washing hands and highly touched surfaces can also help prevent the spread. For young children, especially at preschool, Esper recommends an adult using an alcohol-based rub to remove germs.
Alcohol is actually a better way to clean off their hands than to use soap and water.
If a child is sick, Esper says to keep them home, and you can also consider masking.
We masked up during the first rounds of COVID. We saw flu just drop because everybody was staying away from each other. Everybody was masking when they were out, and flu couldn't get through that.
That was Mandy Gaither reporting, and doctors say other groups who are at higher risk of severe disease if infected with the flu include people over the age of 65 and people with underlying medical conditions.